beautiful people, welcome to Learning with Violet Culture, and in today's video I will be teaching you evaluation of Alzheimer's disease, and it's also going to enhance your knowledge of understanding evaluation. Give this video a like, give this video a thumbs up, and don't forget to share it. All right guys, without wasting time, let us dive directly into our topic for today.
Ryan Little.
Hi guys, welcome back to my channel. My name is Violet Culture. I make learning easy. All right guys, so we are going to be talking about evaluation of Alzheimer's disease. For evaluation, you need two major documents. The first document you need for evaluation is your scenario. Your scenario that tells you everything about the patient which you used for your assessment. All right, I'm going to be sharing the scenario I have here on my screen. The second thing is your evaluation documents. Your evaluation documents. That's the second thing you need. Every paper from assessment, planning, implementation, and evaluation will be given to you when you get to evaluation. But these are the two vital documents you need. Tick. Number two is a silent writing station. However, please hand over the patient. If you are writing, it doesn't concern the assessor. Nobody marks anything you write. What they mark is what you say out of your mouth. So if you want to write so that you don't forget what to say, or so that in case you forget, you can have a look, you can write. That is absolutely fine. And this is a page you can write on, but nobody marks what you have written. It's stated there, as you can see on the document I'm sharing on the screen. Now, I am going to be handing over this patient. The time allocated for evaluation is 8 minutes, but most of my online students have told me they finished in 3 minutes. Now, I am going to hand over this patient and I will explain as I hand over. My name is Violet Okolocha, staff nurse from community setting. How do I know? My scenario said I am a community nurse. I am here to hand over my patients to the community doctors. Nurse Violet, how do you know who to hand over the patient to? It's stated on your evaluation documents. All right? Written documents, look to the bottom. They will say, using the situation background assessment recommendation, kindly hand over this patient to who. Sometimes they will say the doctor, sometimes they will say the examiner, sometimes they will say the dietitian, sometimes they will say the community physiotherapist. It's just so, look there and they will tell you. So in my own case, they said hand over this patient to the community doctors. Then you mention the patient name, Haley Brooke, patient date of birth 15 February 1940, patient hospital number 100010. Patient's address is 2 Norman Road, Dartford. Patient GP is Dr. Sam Westview Cross, Dartford. You mentioned the date, the patient, you visited the patient. Date of visit is today. Time is 6 o'clock. Patient Ellie Brooke was in the community looking very unkempt, refusing to eat, keeps food in the fridge for over 4 months, leave her gas on, cannot perform her activities of daily living. Patient is so anxious and unsettled. Patient is complaining of headache with a pain score of 5 out of 10. Patient daughter lives with her and assists her with activities of daily living. Mention all the presenting complaints. Now, I'm going into my evaluating care documents again. Patient is very confused. She thinks her husband, who died years ago, is still in the house with her. She feels she's seen a dead husband. So I've read the presenting complaint in my scenario. I went to the evaluating care. I've also read the scenario. Now, past medical history. Patient has a past medical history of arthritis and hypertension. Patient lives with her daughter. She does not smoke but drinks alcohol every morning. Patient is currently on citalopram and donepezil, which are the usual medication she takes. Patient is allergic to peanut, and the reaction is rash. An A to E assessment has been conducted on Mrs. Haley, and the most recent observations are temperature 37, pulse 90 beats per minute, respiration 20 counts per minute, BP 140/80, SpO2 98, and patient is having a new score of 0. Please, patient should be monitored according to the new score, which is 12 hourly. The problems identified during assessment are your two care plans. Number one, Mrs. Haley Brooke complains of headache with a pain score of 7 out of 10. Number two, Mrs. Haley Brooke is at risk of malnutrition due to poor oral intake. A cognitive assessment has also been carried out, and Mrs. Haley is having significant cognitive impairment with a score of 17 out of 28. My recommendation is monitor and record Haley's observation 12 hourly, which is according to the new score. Assess Mrs. Haley for any sign of pain using the pain assessment tool, and assess Mrs. Haley for any sign of malnutrition like loose ring, loose band, muscle wasting. You see, I'm giving back my care plans now. Teach Mrs. Haley to eat small food at regular interval. Also teach Mrs. Haley deep breathing exercises and repositioning for comfort. Administer all prescribed medications to Mrs. Haley and monitor its effectiveness after 30 minutes. Mrs. Haley should be referred to the mental health team, the psychiatric team, and the neurological team, as well as the occupational therapy team, just in case she might need package of care. Inform Mrs. Haley to always call 999 or 111 or GP as the case may be. Document all care planned. And thank you very much. Sick. If you hand over this patient like this, your sister will be like, oh my God, who is this? Who is this? You see, you took them through a journey, your situation, you said everything, you said your name as a nurse, you said your setting, you've mentioned who you are here to hand over the patient to, you've mentioned the patient name, date of birth, hospital number, you've mentioned the patient GP name, you've mentioned the patient's address, you've mentioned the date of your visit, you've mentioned the time of your visit. That situation. Now you went to background, you mentioned past medical history, you mention every presenting complaint the patient has. Every presenting complaint, you must mention it, including the one on the evaluating care. You've mentioned all of them. You've mentioned the past medical history, you've mentioned the social history, you've mentioned the allergy, you've mentioned the drug the patient is taking. Oh my God, what a brilliant nurse. You went further, you said to them an A to E assessment has been completed. You mentioned the most recent observation. You went further to identify your two problems, which are your two nursing care plan. You went further again to tell them a cognitive assessment, a cognitive assessment has been carried out on this patient, and she is having a 6 CIT score of 17 out of 28. What a brilliant nurse. You went further and you said, my recommendation is you have to monitor patient 12 hourly. You have to assess this patient for pain using the pain assessment to assess her for any sign of malnutrition, loose ring, loose band, muscle wasting. You have to teach patient to eat small food at regular interval. You have to administer all prescribed medication and monitor its effectiveness after 30 minutes. You have to refer Ellie to dietitian because she's not eating. You refer Ellie to mental health team, refer Ellie to psychiatry team, refer Ellie to a neurological team, refer Ellie to occupational therapy for placement. Oh my God. And you have to inform Haley to call 999 or 111. What a brilliant nurse. Indeed. Well done. So guys, I'll see you in my next video. Keep passing your OSCE exam. Feel free to pop in any question you don't understand. I'll do my best to answer. I can't wait to congratulate you. All the best.